The Phil Meyer Show on 106.3 KMET and 99.3 KCMD.
Good conversation there with Jay Beaver. And we're going to talk again with another person. This time it's going to be about women's health and something. I was pitched this last week, and I thought, this is kind of interesting. And because, of course, I'm married to someone who, of course, struggled with cancer a number of years ago. And Linda, of course, is just fine now. Thank goodness. Boy, I'll tell you, there was a little touch and go there for a while, but she is doing just fine these days. So I have a dog in the fight of people who are suffering from cancer. And anytime there's a new treatment out there or something going on, I wanted to make sure and hit some of this. And I'm going to talk with Leo Twiggs, who's the Director of Medical Affairs at Aspira Women's Health. And this has to do with, I believe it is a new test or new monitoring of ovarian cancer. Ovarian cancer is like number 5 in cancer deaths among women. And it is the most deadly of all the reproductive area cancers. It's just been a tough one. And so many people that I've either read about, even some that I've known within the family and friends and that sort of thing, it's like you find out about ovarian cancer just in time for someone to die. You know, it's like pancreatic cancer. By the time it's diagnosed, you're just a few weeks later, and then boom, gone. And anything that could help some people out, I'm good. And anyway, we'll talk with Leo here, get him on a little bit after the NBC5 News and catch up on various other things. Dr. Powers will also be joining me with Where Past Meets Present, talking about local history. That's always fun, and kicking things around in the news. 20 before 8. Appreciate you being here this morning. And joining me is Leo B. Twiggs, Director of Medical Affairs at Aspira Women's Health. Leo, it is a pleasure having you on. Welcome to the show.
Yeah, great. Can you hear me?
Yep, I sure can. Can hear you just fine. Now, gosh, you've had all sorts of work in the medical field. I mean, so you started out as a professor. Would that be fair to say?
Well, I guess I started out as a professor. I worked real hard. It was just a regular doc, and then I went for extra training and became a cancer surgeon, and then I became I did all these kinds of things. Experience is supposedly a good teacher at times.
Okay. Well, yeah. In other words, you know your stuff, and it has your experience has then been brought to bear on ovarian cancer. And is it fair to say, I had mentioned this, saying that you were going to be joining me here in just a moment, that a lot of times ovarian cancer for women does not get detected until it's very late in the game. And sometimes, you know, like pancreatic cancer, you hear about people that are diagnosed by pancreatic cancer and then they're dead in 6 weeks. You know, that kind of thing. It's tragic. And what do you have new that's out there, some technology to help maybe cut these numbers?
I guess you're right about that. It's discovered late. So one of the things is that one of the most important things a person can do, a woman can do for her ovarian cancer risk, is understand her family history. So it's important for them to know the family history, her mother, her uncles, her aunts, her kids, herself, what kind of, if she's had ovarian cancer or other types of cancers, then spend some time talking to her doctor about that. That's the first thing. The second thing is that if a patient has vague symptoms, abdominal symptoms, bloating, not feeling well, pain, pelvic pain, other kinds of things, there's no reason to not see the doctor and get an ultrasound done, because an ultrasound will show the size of the ovary, and if we can find the ovaries enlarged, then we can do some of the tests we have developed by Aspira Women's Health to help the clinician decide if the patient needs surgery or if there's cancer there, or whether they can be watchfully waited and no further therapy needs to be done. Ah,
okay. Because from what I understand, most of the time, or a large percentage of the time, women. Now, what is an adnexal? Is it an adnexal mass?
Adnexal, yeah, okay. That's our term for ovarian enlargement.
Okay.
And because the ovary can get bigger, it changes size as it ovulates during your normal menstrual cycle. But when it gets too large, then it becomes an adnexal mass. And the reason we use the word adnexal is because it's not always the ovary. Sometimes it's the fallopian tube. Sometimes it's a appendiceal abscess. Sometimes it's other kinds of things. So we use the word adnexal, which allows us to categorize it that way. And when you have an adnexal mass, you usually get an ultrasound, which shows that, a vaginal or abdominal ultrasound, or sometimes a CT scan or MRI. when you get those kinds of tests, then we have a blood test which can help clinicians decide what to do with the individual patient.
And that's the reason for this, because one of the stats I was reading from your notes here is that 6 out of 7 women who undergo having their ovaries taken out because they have this enlarged mass and they're concerned about cancer, most of them do not have cancer. Isn't that the case?
Well, that's the good news. Yeah, most of them don't have cancer, and so we're searching for the needle in the haystack.
Right.
We're trying to find that particular patient who has ovarian cancer, excuse me, who could be cured early with the removal of the ovary, and that's the problem. We do a lot of surgery that doesn't have to be done because we don't have precise techniques, and that's where our company comes in.
Okay, and this is a blood test, OvaWatch, that you've developed, right? That's what the company's done?
Yeah, OvaWatch and OvaOne are 2 tests. We have what we call OvaSuite, which is a cadre of tests. And OvaWatch is the test that the clinician does when they don't think there's cancer there, when they're not going to do surgery. In their mind, they don't think there's cancer there. So this gives us a 99% chance of telling us whether or not there's cancer there. So that's called OvaWatch. Our other test is OvaOne, which is the test which is when the doctor thinks surgery is necessary. It allows you to triage the patient to the right clinician, i.e., the cancer surgeon who it's been shown that the cancer surgeon does a better job with survival and so forth, getting the first crack at the particular patient.
Huh. I'm not familiar with that. So not all cancer surgeons are alike when it comes to treating potential ovarian cancer.
Yeah. There's really great gynecological surgeons, and then there's gynecological oncologists. So there's gynecological surgeons are often laparoscopically trained. They're wonderful surgeons, but they don't do cancer surgery, and cancer surgery should be done by the subspecialist, and there's data to show that. But what's important is most patients don't have cancer, so lots of these gynecologists do very, very wonderful surgery in patients. But what they need is a test like ours to allow them to triage them, or if they're temporizing and they don't think patient needs surgery, to assure them and the patient that there's a 99% chance there's no cancer there.
Yeah. Now, when my wife ended up going through gynecological cancer surgery a few years ago, they had to do the whole big needle in the tummy biops type thing, and it was pretty brutal from the looks of it. Just the way she described it was just horrendous here, Doc. And so I guess the thing about this, though, is that this blood test, this OvaWatch SM, is about finding the tumor markers in a blood test, right? It's that way.
Yeah. The idea is that there's a number of blood markers that have been shown to be associated with ovarian cancer. So what we've done is we've taken those blood markers, and then with a specialized algorithm, which is proprietary, which is our work value, is that this algorithm allows you to weigh these various tests and allows you to come up with a test that gives you a great predictive value, 99.99% negative, which means negative predictive value. Means if the test is negative, the cancer there 9%.
Okay, yeah, Leo, we're losing your cell phone a little bit there. Let's see if we can maybe reposition it or something. I'm just losing you a little bit.
Okay.
Okay. Yeah, we got you. All right. Yep, we got you back here. Got you back. Leo B. Twiggs, once again, Director of Medical Affairs at Aspira Women's Health. And I'm going to put this up there. This test for ovarian cancer, I think this is a fascinating new thing because non-invasive, and I think that's more helpful as time goes on. And what you're saying, and I didn't realize, though, is that you really don't want to remove a woman's ovaries unless you really have to, right? Because there's some really serious health problems that come when you do stuff unnecessarily. And what is that? Just curious.
Yes, that's exactly right. The large data have shown that removal of ovaries before menopause and even after menopause is associated with early onset dementia and some other heart disease, other kinds of diseases. So one of the things is the ovaries continue to play an important role in the woman's life throughout her lifespan. And so we don't really want to remove the ovaries unless it's absolutely necessary. In the past, we didn't have that kind of data. we didn't know that ovarian removal had these effects on the population at large.
Well, yeah, if you go back 30, 40, 50 years, wouldn't they just routinely remove ovaries and not think too much about it? Just like, well, it's no big deal, right?
Exactly right. And we're getting much more smart and more intelligent about what we do to patients. And we've learned by doing these large studies. And this is why this oval watch test is helpful, because it gives the clinician more precision in his or her clinical decision making.
Mm-hmm. How new is this, Leo?
Well, Oval Watch has been out since for almost a year now, and our other tests have been on the market for about 10 years. So,
okay,
we're a company's been around for about 10 years, and we're the really the only company that's working in this area of the commercially available test for clinicians to avail themselves to.
Yeah. Did I understand correctly when I heard you? Was there a mention of almost an artificial intelligence aspect to this test?
Almost. We call it a neural network. And what basically one way of looking at the neural network is the way that is when you first learn how to drive a car. Your criteria is some way. Every time you drive a car, you learn how to drive a car. You'll get better at making sure that's not another car. That's the stop sign. Da da da. Uh-huh. So again, the neural network allows us to learn as we change the levels of the biomarkers and the biomarkers. So that's what this company does. It develops these kinds of tests, these algorithms, which are then proprietary, and they're also useful in these kinds of clinical situations to give the clinician more understanding.
Yeah. Well, I have to tell you, it's probably a good idea to pick up one of these or to have the doctor or whoever you have working with you, that if you are suspecting ovarian cancer, that you try this out because it's non-invasive, which of course is very, very nice. And that way you
blood test.
Yep. And you end up avoiding unnecessary surgery. Woman remains healthier, has a better hormonal balance and things like that. You know, there's a reason why we have these organs in us in the first place. You know, everything has.
I guess there is.
Yeah.
They're not just there for a surgeon to remove.
Yeah, exactly. And this is pretty fascinating. I appreciate you bringing this up. And is it something where can you actually go and ask for a test like this yourself as a layman, or do you have to kind of get it through the medical world?
Well, the first thing I said was the most important thing is to understand your family history of cancer, all kinds of cancer. That's number one. Number two is then if you have any symptoms at all, you should see your doctor. And there's no reason why you couldn't mention the test if you to the doctor if you see the doctor. Most doctors will understand it. Sometimes they don't because general doctors don't see a lot of these patients. They might see it in nexual mass once every 2 or 3 years, so therefore they're not totally up on it. And that's one of the reasons we're on radio talking about it.
Yeah, well, I'm going to put this up on KMED.com about Ova Watch SM by Aspira Women's Health, this blood test we're talking about. The other thing I was wondering, since you were talking about a little bit of AI, and that's been the big topic du jour for a lot of people, I would imagine that you're quite familiar with the way most pap smear tests and other cancer tests are done, in which a lot of times the cells that are being examined are put before humans. Do you see the day coming in which the computers will be doing most of that instead of humans actually looking at these cells and coming up with that's already been done, and actually going to be it's just going to be made better. And what's going to happen over the long term is that we're going to measure different kinds of protein markers in people's bloods and come up with risk evaluation. So this is just starting. This whole field is just starting. And again, remember, our test is not a screening test. It's not a test that screens for ovarian cancer. You have to have the nexual mass, or you have to have symptoms or some other abnormality. Yeah, you have the symptoms, you have the enlarged, the mass, or they suspect that you have an enlarged ovary, and then we can do something like that. Okay, all right.
Exactly. We don't want to pretend we're something we're not.
All right, very good. Leo, I really appreciate you. Leo B. Twiggs, Director of Medical Affairs at Aspira Women's Health. I'll put all your information up, and if people want to find out more, we'll make it easy for them to find you, okay? And I thank you so much.
Oh, thanks again. Nice talking to you.
All right, nice talking with you, too. Anything that could help people avoid unnecessary surgery, keep the body intact and not just have organs cut out that shouldn't be, right? It's a 7:53, and you're on KMED and KCMD.